Today, we want to show you, step by step, how a hair transplant using the DHI technique is performed at our DHI Panama clinic. The DHI technique, direct hair implantation, is characterized by a precise protocol involving the individual extraction and implantation of hair follicles. One of its key components is the exclusive DHI Implanter, an instrument designed to allow the physician to precisely control three essential aspects during implantation: the direction, angle, and depth of each follicle. This level of control makes it possible to recreate the hair's natural growth pattern and perform a minimally invasive implantation while also promoting a faster recovery. But the entire process begins long before the day of the procedure. Step 1. Diagnosis and hair analysis. Before recommending a hair transplant, we perform a medical evaluation and a detailed analysis of the hair and scalp. During this evaluation, we determine the type and degree of hair loss, the density and quality of the hair in the donor area, the characteristics of the recipient area, and the approximate number of hairs that will need to be implanted. We also evaluate how the patient's hair loss may progress in the future. Why is this so important? Because a hair transplant should not be planned solely around how the patient looks today, but also around how their hair may evolve over the years. Using all this information, we develop a personalized hair restoration plan. Step 2. Hairline design. The day of the procedure begins with one of the most important stages, the design. Our specialist physician carefully designs the hairline, taking into consideration the patient's age, facial proportions, original hair growth pattern, the available density in the donor area, and, of course, the patient's expectations. The goal is not simply to implant more hair. The goal is to create a distribution that looks natural, balanced, and appropriate for each individual patient. Once the design has been approved, the DHI procedure begins. Step 3. Preparation and anesthesia. The donor area is carefully prepared, and local anesthesia is then administered. This allows the follicles to be extracted while keeping the patient comfortable throughout the procedure. Step 4. Follicle extraction. The follicles are extracted individually from the donor area using specialized micro-instruments. Each follicular unit is handled carefully to protect its structure and preserve its viability. Unlike techniques that require the removal of a strip of scalp, this procedure does not involve a linear incision or require stitches. The extraction is performed follicle by follicle. This also allows the extraction points to be carefully distributed, preserving a uniform appearance in the donor area. Step 5. Classification and preservation. Once extracted, the follicular units are immediately transferred to our clinical team. This is where an extremely meticulous process begins. The follicles are examined and organized according to their characteristics and whether they contain 1, 2, 3, or more hairs. This classification is essential. Single hair follicles, for example, are especially important for creating a delicate, natural-looking hairline, while follicular units containing multiple hairs can be strategically used to create greater density in other areas. While waiting to be implanted, the follicles are stored in hypothermosol, a specialized preservation solution designed to help maintain cells and tissues under suitable conditions while they remain outside the body. The proper extraction, handling, preservation, and prompt implantation of each follicle are essential factors for its survival. According to protocols and data reported by DHI Global, graft survival rates can reach up to 97%. Step 6. Loading the DHI Implanter. We now reach one of the stages that truly sets the DHI technique apart. Each follicular unit is carefully loaded into the DHI Implanter. The instrument is then ready for the physician to perform the implantation directly. This is where precision and planning come together. Step 7. Direct implantation. After local anesthesia is administered to the recipient area, the implantation process begins. Using the DHI Implanter, each follicle is placed individually according to the previously established design. The physician controls the depth, direction, and angle of each implantation. These three elements are essential to ensure that the new hair follows the same growth pattern as the patient's natural hair. An important feature of DHI is that it is not necessary to create all the recipient channels in advance before placing the follicles. With the implanter, the creation of the recipient site and the placement of the follicle occur as part of the same implantation process. This allows the physician to work with a high level of precision, even around existing hair. Step 8. Final review. Once the planned number of hairs has been implanted, our team performs a detailed final review. We assess the distribution, density, direction, and design of the implanted area, as well as the condition of the donor area. At the end of the procedure, the patient receives specific instructions regarding washing, sleeping position, scalp care, and the activities that should be avoided during the first few days. A new stage then begins: recovery and growth. What happens after the transplant? During the first few days, it is normal to notice small scabs and some redness in the treated areas. These signs gradually subside as the scalp begins its recovery process. Over the following weeks, a temporary shedding of much of the implanted hair may occur. This is expected and is part of the follicle's natural growth cycle. Although the visible hair sheds, the follicle remains beneath the scalp and begins preparing to produce new hair. The first new hairs generally begin to appear around the 3rd or 4th month. Between the 6th and 8th months, the transformation becomes much more noticeable with a gradual increase in density. By around 12 months, most of the result can usually be appreciated, although some patients may continue to experience further growth and improvement during the following months. The rate of growth and the final result can vary from one person to another. That is why follow-up care is a fundamental part of the entire process at DHI Panama. Because a hair transplant does not end on the day of surgery. It begins with an accurate diagnosis, continues with a personalized design, and requires precision with every implanted follicle. That is the DHI philosophy. Diagnosis, design, precision, direct implantation. Every hair has a direction, every follicle has its place, and every patient needs a hair transplant designed specifically for them. DHI Panama. Learn more about our procedure and discover whether you are a candidate at DHI Panama.